Good afternoon, everyone. My name is Rene Calandria, and I'm the Patient Care Coordination Manager at the Nova Psychiatric Assessment Center in Fairfax, Virginia, here in the United States. My research is on the effect of integrative cognitive behavioral therapy, existential therapy, for a client with complex comorbidity of post-traumatic stress disorder and attention deficit hyperactivity disorder with existential anxiety, a single subject experimental study. The integrative CBT existential approach combines the structured techniques of cognitive behavioral therapy with the philosophical insights of existential therapy to enhance therapeutic relationships and address existential concerns, ultimately improving outcomes. Integrating mental health into the broader development frameworks is crucial for achieving United Nations Sustainable Development Goals with culturally sensitive adaptations such as incorporating Eastern philosophies, ensuring better support for diverse population. In the Philippines, declining mental health scores, persistent stigma, underfunding, and limited service access highlight ongoing challenges within the mental health. Despite overlaps between existential psychotherapy and CBT, there is a research gap regarding the application of an integrative CBT existential therapy for Asian clients with complex comorbidities of PTSD, ADHD, and existential anxiety, which this study seeks to address. The experimental study investigated the effectiveness of integrative CBT existential therapy as a therapeutic approach for individuals with comorbid PTSD and ADHD accompanied by severe anxiety, existential anxiety. The results will address gaps in integrative CBT existential therapy research and contribute to a comprehensive model, including a treatment manual for practicing psychologists and therapists. This CBT existential therapy manual will provide essential baseline data that is effective and tailored interventions for individuals with these comorbidities. Further, a separate publication of a self-developed existential anxiety questionnaire will benefit the Filipino population since the psychological instrument is culturally designed incorporating Filipino philosophical social norms. The design of this paper utilized an ABA single subject experimental design to systematically monitor a defined target behavior, an area of depressive symptomatology, across baseline or pretreatment period, intervention stage, and reversal phases to establish causal explanation for behavioral change observed following the intervention stage. The participant of this study was a 20-year-old woman from a highly urbanized city in the Philippines with diagnosis of comorbid ADHD, PTSD, and severe existential anxiety. The researcher employed purposive sampling to select a deviant case referred by a local psychological clinic, enabling an in-depth exploration of unique factors and refining theory in a single subject design, while streamlining data collection and leveraging the participants' comprehensive case understanding. The standardized instruments used in this study were the National Stressful Events Survey PTSD short scale to monitor the PTSD symptoms, the ADHD Clinical Outcome Scale or ACOS clinician to monitor the ADHD symptoms, the Hopkins Symptoms Checklist to monitor depressive and anxiety symptoms, and the self-developed existential anxiety questionnaire to monitor existential anxiety, and the personality inventory for DSM-5 brief form to monitor and assess maladaptive personality traits, focusing on 5 areas of pathological personality domains, such as negative affectivity, detachment, antagonism, disinhibition, and psychoticism. For the data collection, there are 2 stages in the data collection: the pre-experimental or preparation stage and the experimental stage. The experimental stage involved three phases: pre-intervention, intervention, and the post-intervention. The pre-experimental stage focused on building rapport, assessing the client's symptoms and relevant clinical demographic factors, conducting comprehensive medical and psychological evaluation, securing informed consent after explaining the study, and performing baseline testing to ensure accurate diagnosis and holistic care. During the experimental stage, the pre-intervention phase consisted of a comprehensive 9-day baseline assessment of the client's co-occurring symptoms, including existential anxiety, depression, PTSD, and ADHD, monitored by a registered psychometrician and supervised by a psychiatrist to establish a stable clinical profile. In the intervention phase, the participant received brief integrative CBT existential therapy targeting her comorbid conditions twice weekly for 6 weeks, with treatment individualized to her needs. The post-intervention phase involved a 7-day return to baseline period with ongoing symptoms and vital sign monitoring, but no active treatment has been introduced during this phase to assess the maintenance and stability of therapeutic effects compared to baseline. For the data analysis, the data were organized for visual representation, as graphical analysis was a central interpretive method in single case research. Visual analysis of graphical data supported by numerical values enabled interpretations of symptom trends and fluctuations over time, with indicators like behavioral level, trend direction, and the data variability used to assess the effectiveness of interventions. For the summary findings, the participants' vital signs throughout all study phases, the participants' vital signs including temperature, pulse rate, oxygen saturation, and blood pressure remained within normal limits, with only minor, non-significant fluctuations observed. No fever or infection was detected, and the body temperature did not surpass the fever threshold at any point. Although a slight increase in average pulse rate was noted compared to the baseline values, but all these values remain stable within normal range post-intervention, except for a single non-critical low reading. Oxygen saturation and the blood pressure also stayed consistently normal, indicating that the integrative CBT-Existential Therapy did not negatively impact the participants' physiological status, underscoring the safety and non-invasive nature of the intervention, even in the context of comorbid PTSD, ADHD, and existential anxiety. For the psychological monitoring, there was a routine mental status evaluation. At the start of the monitoring, the participants showed symptoms of ADHD, PTSD, and existential anxiety, but maintained normal appearance, intact sensorium, and coherent thought process. Despite a dysphoric mood, sad expression, and preoccupation with relationship stress, her cognitive abilities remain unimpaired, though she struggled with self-control and relied on others for support. For the visual analysis of participants' anxiety and depression level, visual analysis using the Hopkins checklist revealed that the participant experienced clinically significant anxiety and depression at baseline, with T-scores indicating moderate to severe anxiety that decreased steadily during integrative CBT existential therapy and remained low post-intervention. Visual analysis per Miller confirmed a clear division between baseline and intervention phases, suggesting that therapy produced a reliable and lasting reduction in anxiety symptoms, a finding supported by related literature emphasizing the effectiveness, stability, and durability of integrative and existential therapeutic approaches. Visual analysis of the participants' depression levels showed that these scores were consistently high during the baseline, but declined substantially during integrative CBT existential therapy, with the most significant reduction occurring toward the end of the treatment. Although symptoms partially increased after therapy ended, they actually remain lower than the baseline, supporting the effectiveness of the intervention in reducing depressive symptoms and highlighting the importance of ongoing support for lasting benefits. For the visual analysis of the participant existential anxiety level, the scores showed the participants' existential anxiety remained at a moderate, clinically significant level across all phases, with these scores averaging 34.4 at baseline, 37 during intervention, and 36.86 post-intervention, reflecting the complex nature of existential work, where increased anxiety may signal productive engagement with core issues such as meaninglessness, and supporting research which suggests that existential and meaning-centered therapies can actually initially heighten distress, but ultimately provide relief, especially with ongoing support. For the visual analysis of the ACOS clinician score, the scores revealed a distinct and sustained reduction in ADHD symptoms and related functional difficulties during and after integrative CBT existential therapy, with no overlap between baseline and intervention phases, indicating treatment effectiveness and durability according to Miller's visual analysis criteria and supporting research. This pattern indicates maintenance and generalization of treatment effects, which is highly desirable in clinical practice. According to the principles outlined in Miller, the lack of return to baseline is often interpreted as an evidence for the durability and real-world impact of the intervention, especially for therapies that teach skills or foster new perspective rather than simply suppressing the symptoms. For the visual analysis of the ACOS inattention and functional difficulty score, the data demonstrated a clear and sustained reduction in inattention symptoms and functional impairments during and after integrative CBT existential therapy, with most of the intervention phase scores consistently lower than the baseline and only minimal overlap post-intervention, supporting the therapy's effectiveness according to Miller's visual analysis criteria and the scale's reliability in ADHD assessment. For the visual analysis of data points on the severity of PTSD symptoms, the data points from the single subject ABA design showed that the participants' PTSD symptoms, as measured by the NSESSS PTSD, decreased from stable moderate levels at baseline to mild levels during and after integrative CBT existential therapy, with a clear division and stability between phases, indicating the intervention's effectiveness and durability according to the criteria in Miller's visual analysis. For the visual analysis of the participants' negative affectivity, the scores showed a clear and sustained reduction from a very high baseline mean, which is 2.8, to moderate to high mean, which is 2.24, during and after integrative CBT existential therapy, with no overlap between baseline and subsequent phases, demonstrating a meaningful and lasting improvement in emotional regulation and psychological health as per Miller's criteria and recent research. On the data points of the participants' detachment, the scores indicated stable but overlapping values across baseline intervention and post-intervention phase, ranging from 1.6 to 2.0, which according to Miller's 2006 criteria, demonstrates no convincing division or meaningful effect of integrative CBT existential therapy on this personality trait, with recent research confirming that clear separation between phases is actually necessary to attribute the improvement to the intervention. For the data analysis of the participant antagonism, the scores showed stable values within each phase and a clear, non-overlapping reduction from a moderate to very high baseline mean, 1.88, to lower means during the and after the integrative CBT existential therapy, which is 1.1 to 1.12 and 0.96 respectively, providing strong evidence of a meaningful and lasting reduction in antagonistic traits according to Miller's criteria and recent research. For the participants' disinhibition, the scores revealed only a modest and overlapping reduction from the baseline 2.8 to intervention and post-intervention phase, which is 2.6 and 2.4 respectively, with stable but still high scores indicating that the integrative CBT existential therapy did not actually produce a meaningful or convincing improvement in disinhibition according to Miller's criteria. For the visual analysis of the participants' personality domain on psychoticism, the scores showed a modest and stable reduction from baseline to intervention and post-intervention phases. But the presence of overlapping values between phases means that the improvement is not convincingly attributable to integrative CBT existential therapy according to Miller's criteria. But if you look at the overall score, however, the score demonstrated highly stable data within each phase and a clear non-overlapping reduction from baseline. The mean is 2.3 to intervention. The mean is 1.91, and the post-intervention whose mean is 1.8. Providing strong evidence that the integrative CBT existential therapy produce meaningful and lasting improvements in overall personality functioning according to the criteria of Miller and recent research. In conclusion, the findings of the study showed that integrative CBT existential therapy can be delivered safely and effectively with no physiological reaction, as demonstrated by the participants' stable vital signs in all phases. Psychological monitoring of the participants showed substantial lasting effects in the areas of anxiety, depression, ADHD symptomatology, PTSD severity, and specific maladaptive personality traits, including negative affectivity and antagonism. And this impact was well supported by Miller's visual analysis criteria. Miller's visual analysis is a suitable analytic method for representing not only the significance and the clear division of data of the changes taken, but also the causal relationship to the intervention. The study also demonstrated that the intervention provided greater self-awareness and coping with existential anxiety without increased distress, but continued support is recommended for stable mood and existential adjustment. Nevertheless, on personality domain, only on detachment, disinhibition, and psychoticism was the therapeutic effect observed, which indicates that integrative CBT existential therapy is effective and safe for people whose comorbidities are complex, but they may need adjunctive strategies for personality features. The fundamental conclusion is that integrative psychological intervention is an effective, safe, and non-invasive treatment option for complex clinical profiles but continued personalized and specific support and follow-up is necessary for holistic long-term outcomes. And these are all the references cited in this paper. Thank you very much.